Shoulder grinder behind the neck press. The shoulder grinder is a mechanical deception that most lifters treat as a standard vertical press, but the professor knows better. To execute this movement, you are forcing the humerus into a state of extreme external rotation and abduction that the human skeletal architecture was never designed to support under load. As the bar descends, the acromion process acts like a biological vice, grinding directly against the supraspinatus tendon and physically deleting the subacromial space. This isn't just tightness, it is the anatomy of failure leading to chronic impingement or a surgical rotator cuff tear. When you force the weight behind your head, you are pushing the humeral head into the anterior capsule, stretching the ligaments to their breaking point while simultaneously crushing the tendons in the back. You are trading the long-term health of your shoulder capsule for a marginal increase in medial delt activation, creating a wear and tear blueprint that results in permanent joint instability. The data is clear. The shoulder grinder is a top-tier candidate for joint suicide. If you value your career and your ability to lift into your 40s, you will shift the bar to the front into the scapular plane to save the grinding for the muscle, not the bone. The rotator cuff guillotine, upright rows. The rotator cuff guillotine is a staple in many traditional programs, but it operates as a clinical trap for the shoulder joint. By pulling a weighted bar close to the body with a narrow grip, you force the humerus into a state of extreme internal rotation at the very top of the movement. This creates a scissors effect within the shoulder capsule, where the head of the humerus jams directly into the acromion process, shredding the soft tissue and the tendon of the long head of the biceps over time. Most lifters mistake the sharp ping or catch in their shoulder for a deep muscle pump, but in reality, it is the sound of your anatomy reaching its structural breaking point. Continuing to perform the rotator cuff guillotine is a guaranteed path to chronic inflammation, bursitis, and a permanent loss of overhead mobility. You are effectively sandpapering your own tendons for the sake of traps and side delts that could be built much more safely. The data is undeniable. This exercise is a slow motion form of joint suicide. To save your career, the professor recommends widening your grip significantly to allow the humerus to move through the scapular plane, or better yet, swapping to lateral raises where the muscle can fail without the bone taking the hit. The preacher snap full extension curl. The preacher snap is a masterclass in mechanical disadvantage that the professor considers one of the most dangerous points of failure in the gym. By pinning your arms against a steep bench, you are removing all secondary muscular assistance and placing the full weight of the bar onto the distal bicep tendon at its most vulnerable state, full extension. In this bottom 10% of the movement, the leverage is so extreme that the muscle is effectively turned off and the connective tissue is forced to act as a biological brake. Most lifters chase the deep stretch, but in reality, they are playing a game of Russian roulette with their tendons. The data shows that as you reach full extension under a heavy load, the tension on the tendon exceeds its elastic limit, leading to the catastrophic snap that can end a training career in a fraction of a second. This is the anatomy of a tear, a clinical result of forcing a hinged joint to bear maximum load at its weakest mechanical angle. To avoid this joint suicide, the professor recommends stopping the movement just shy of full lockout. You must keep the tension on the muscle belly and away from the tendon, or risk the surgical referral that every preacher curl devotee eventually fears. The disc decoupler, bought out leg press. The disc decoupler is a hidden danger where the ego of the lifter often overrides the reality of human spinal mechanics. While the leg press is a phenomenal tool for quadriceps development, most lifters commit joint suicide by chasing a range of motion that their anatomy cannot support. When you allow the platform to descend too deep, the hips reach their maximum degree of flexion, causing the pelvis to tilt posteriorly in a movement known as butt wink. This effectively peels your lower back off the safety of the pad, forcing your L5-S1 vertebrae to bear the entire load in a compromised rounded position. This mechanical error creates a massive shear force that attempts to push your spinal discs out of their structural alignment. You aren't training your legs at the bottom of a deep leg press, you are simply decoupling your spine and inviting a catastrophic disc herniation. The professor warns that once the lumbar spine rounds under several hundred pounds of pressure, the biological damage is often irreversible. To save your career, you must respect the data of your own mobility, stop the descent the moment your lower back begins to lose contact with the seat, ensuring the tension stays on the muscles and away from your nervous system. The knee shredder, locked leg extension. The knee shredder is a clinical demonstration of why isolation isn't always synonymous with safety, particularly within the professor's anatomy of failure framework. While the leg extension is designed to target the quadriceps, performing a forceful lockout under heavy resistance places an unnatural shear force on the anterior cruciate ligament. At the top of the movement, the tibia is effectively being pulled forward while the kneecap is smashed back into the femur with maximum intensity. This mechanical conflict creates a grinding effect on the cartilage behind the patella, leading to a condition known as patellofemoral pain syndrome, a common result of ignoring biological red lines. By consistently snapping the knees into a locked position, you are bypassing the muscle's protection protective tension and shifting the load directly onto the joint's delicate internal structures. The data suggests that this repetitive high-velocity lockout is a primary contributor to chronic tendinitis and the eventual degradation of the meniscus. This is a clear-cut case of joint suicide, where the burn you feel isn't muscle growth, but the biological distress signal of your connective tissue being sandpapered into oblivion. To protect your longevity and avoid the genetic lottery of chronic injury, the professor advises maintaining a soft lockout at the top, squeeze the muscle with a controlled contraction, but never allow the joint to take the hit for the sake of a completed rep. The capsule tear, flared elbow dips. The capsule tear is a high-risk mechanical failure that occurs when a lifter prioritizes depth over biological alignment. While the dip is often called the upper body squat, performing it with flared elbows and an excessive range of motion forces the shoulder into extreme extension. This shift moves the load away from the triceps and chest and places it directly onto the anterior capsule of the shoulder. The professor views this as a clinical disaster, as the head of the humerus is shoved forward against the ligaments, stretching them to the point of instability. The data reveals that once these ligaments are overextended, the shoulder joint loses its structural integrity, making you susceptible to labrum tears and chronic dislocations. You are essentially trading the stability of your most mobile joint for a few extra inches of movement that the muscle isn't even equipped to handle. This is a classic form of joint suicide that can turn a healthy athlete into a surgical patient in a single heavy set. To safeguard your career, the professor recommends keeping the elbows tucked and stopping the descent when the shoulders are level with the elbows. Never compromise the capsule for the sake of the ego. The tendon time bomb or forehead skull crusher. The tendon time bomb is a clinical demonstration of how a slight change in leverage can lead to a catastrophic mechanical failure. While the triceps extension is a foundational movement, lowering a heavy bar directly to your forehead creates an acute angle at the elbow that forces the triceps tendon to bear the brunt of the load. At this extreme snapping point, the velocity of the movement combined with a high resistance load creates micro tears at the tendon's insertion point on the olecranon. The professor identifies this as a ticking clock for chronic tendinitis or a full thickness rupture. The data suggests that by bringing the bar to the forehead, you are placing the joint in a position of maximum tension with zero muscular leverage to protect the connective tissue. You aren't just building triceps, you are effectively sandpapering the internal structures of your elbow until the bomb finally goes off. This is a clear-cut case of joint suicide fueled by poor mechanical positioning. To save your career and your elbows, the professor recommends bringing the bar behind your head to increase the stretch on the long head of the triceps while shifting the mechanical stress away from the joint and back onto the muscle belly. The trachea trap, flared elbow dip. The trachea trap is a high-risk variation that the professor views as a total abandonment of biological safety for the sake of isolated upper chest stimulation. By lowering the bar toward the neck rather than the mid-sternum, you are forcing the shoulders into extreme abduction and internal rotation under a heavy load. This positioning creates a guillotine effect that jams the humeral head into the subacromial space, shredding the rotator cuff and the long head of the biceps with every repetition. You are placing the joint in a position where its structural integrity is at its lowest, essentially daring the connective tissue to fail under the pressure. As the bar descends toward the clavicle, the elbows are forced to flare out at a 90-degree angle, which exponentially increases the torque on the shoulder's anterior capsule. The data indicates that while the muscular stretch feels intense, it is actually a signal of the ligaments being stretched to a dangerous degree, far beyond their intended capacity. One minor slip, a loss of focus, or a sudden mechanical failure doesn't just result in a missed lift, it puts the cervical spine and the trachea in the direct line of fire, turning a training session into a life-threatening emergency. This is a premier example of joint suicide, where the potential for a catastrophic injury far outweighs any marginal muscle growth. You are essentially choosing to sandpaper your internal architecture for a visual pump that won't matter if you're in a sling. To protect your career, the professor insists on a standard powerlifting or bodybuilding tuck, where the elbows remain at a 45-degree angle. This alignment keeps the tension on the muscle fibers and away from the delicate structures of the neck and shoulder joint, ensuring you stay in the gym rather than the operating room.